I see somebody saying use XYZ to get a better smile, drink this to become thinner, eat this to do that, and so many things, right? And as a doctor, everyday challenges are these for us, because it's not that patients are not trusting doctors, but the fundamental problem is they are having a lot of information that is accessible to them, which is not certified. We are healing, but by doing something that could be potentially painful in the short term, but can have long-term benefits. 90% of children and 100% of adults have dental problems. We are thinking modern science or modern medicine is different from traditional medicine or traditional living. It's actually not that. No dentist on this planet Earth can solve you of your dental problems by going to them.
A smile is more than just an expression. It's a way to connect to people's hearts. A simple smile can just spark a conversation or even change someone's life. And it's the most simplest way of spreading joy to the entire world. Are you wondering why I'm going on and on about smiles? Well, hi, I'm Chinmay, a CA aspirant and a print model, and today your host for today's podcast. I'm super thrilled to have here with us today Dr. Srivatsa, a specialist dentist who specializes in special needs and preventive dentistry and is a very passionate dentist who's, aiming to spread some knowledge to the world. Hi, sir. Namaste.
Hi, namaste, Chinmay. Good to have you here.
Likewise. How are you
Thank you.
doing today?
Well, doing good. Being a Sunday, it's a good day to work, I think. And as always, in the last 28 years, the focus has been to do good to the society, to learn more, to be a lifelong learner, and keep improving each day and be a better person than you were the last night.
Wow, that is very well said. And I personally think that it's very important for doctors to come into social media and content creation so that the certified knowledge that you people
Hmm.
have reaches to all people much in a easier access. So
Yes.
it's a really nice initiative that you've started off with the podcast series. So we're very
Yeah.
happy to have you today, sir.
Thank you. Yes, it's very important, Chinmay, because you're absolutely right. Because even when I go on social media and check some of the YouTube videos and stuff like that, we see things such as this random, right? I see somebody saying use XYZ to get a better smile, drink this to become thinner, eat this to do that, and so
True.
many things, right? And as a doctor, everyday challenges are these for us, because it's not that patients are not trusting doctors, but the fundamental problem is they are having a lot of information that is accessible to them, which is not certified. I like that word when you said certified information or information that's authentic. And why is that important? Because it is the root cause of trust being eroded between a patient and a doctor,
Hmm.
right?
True.
So, like I'll give you an example. I went through a gallbladder surgery a few years ago, and when I reached my doctor, he diagnosed, he said, this is what is required to be done. And then I went through that procedure. I never thought that I should go ahead and check online
Hmm.
what is a gallbladder procedure or why is it required to be done, so stones, this, that, so many things. And post procedure, it actually turned out that it was quite a bad one. There was gangrenous stuff in it and things like that. And uh, when I went back then to look on the internet about gallbladder and stuff like that, I found tons of information about it, where
Correct.
people saying, don't worry about the pain that you're having, so many home remedies, so many, unsolicited advice, which could be misdirectional, you know,
Correct.
which could lead to a lot of harmful things, because the timing of my surgery, if it was further delayed, could have been even worse, right? And so I see this day in and day out that people are reaching out to unsolicited advice. And it is not wrong even for them, because no human being, including a doctor, likes a procedure.
Correct.
Right? Nobody likes harm to their body. In one sense, we are healing, but by doing something that could be potentially painful in the short term, but can have long-term benefits. So people are gullible to information which is soothing for them to hear.
Tell
Right?
them what they want to hear.
Exactly, right? And so I'm looking at popularity. So I can just say anything because I'm not going to be the person in contact with you. So unfortunately, somebody is hearing some videotape from some geography which is not even in their respective geography, and then trying to bring that knowledge into a scientific environment with their local healthcare provider and asking them that this is what I thought it is and this is what I believe, because you'll have a million views on that. It means nothing.
True.
Right? And the second gap is the healthcare provider is trained in one system of practice. Let's say I'm an allopath, right? Now you're coming and telling me that I will want to eat ginger when I have cold and sore throat. What's your opinion? Just recently, couple of days ago, somebody asked me that I don't want painkillers, I'll use clove oil. What is your opinion? I don't have an opinion, because it would be wrong for me to say that it is not good. But in the field that I have been trained and I have been in practice, I have not found it useful because of this, and this reasons. And so we believe in something that is tested, properly researched, and done well, which we are seeing results. Having said this, each person is different. There are no two people, no two conditions that can be similar. In my 28 years of career, every surgery, every procedure that I have done has been different.
Correct.
It might be tooth decay, it might be gum surgery, it can be bone grafting, it can be anything. But when we do it on different people, we have different experiences.
True.
I'm yet to see two things that I did which were perfectly similar on two different people. Forget about two different people, on two different teeth in the same person, it is not similar. And that's the beauty of nature.
True.
And unfortunately, we are trying to classify this entire thing as one standard protocol and trying to get information. So yes, from that sense, that is when this whole thing evolved, that why don't we start having conversations wherein at least we can start busting certain myths.
Correct.
We can start giving out the right information to people, which by itself is a great thing, because people then will be guided into doing the right thing. Right?
That's very true. So to summarize what sir is telling, he is telling don't self-diagnose, don't believe those WhatsApp universities which keeps
Yeah.
sending you random
Spreading,
informations. And yeah, even if you have, like sir said, there's no one cure that fits all. So each
Yeah.
person is different.
Absolutely.
The bodies react differently to different treatments.
Absolutely.
So in that's a beautiful introduction. So to dive down deep in it, so we'll be covering, like since it's the first podcast, we'll be covering basic topics starting
Sure.
from hygiene to braces and of course the beauty
Sure.
behind those perfectly pictured smiles. So
Sure.
just to start off with the basics, sir, anyone who eats like Indian food on a daily basis or has little bit moderate junk food. So what should be their basic oral care to start off?
So actually, it doesn't depend on what kind of food you eat.
Okay.
You can eat any food that you'd like to eat, still have a whole lot of dental issues, or you can just do so-called perfect eating with full mouth of dental problems, or you can be eating the same sort of food and not have any dental problems.
Okay.
How is that possible? If we understand the dynamics of our mouth, The first and foremost thing I'd want you to appreciate that we have teeth, we have gums, we have something called as the tongue, and then all the mucosa or the lining which is surrounding our cheek, lip, inner palate, and so on and so forth. This is a very beautiful cave in which whatever you eat can go and get stuck. What is binding everything in your mouth is your saliva.
Okay.
Right? So we all have saliva. Saliva plays a major role in your oral hygiene.
Okay.
So the pH of saliva is anywhere between 6.8 to 7.2, which can be neutral to alkaline. Whenever we eat any food item, the salivary pH drops.
Gets more acidic.
It gets more acidic.
Okay.
There are certain food items which do not cause this flux and do not make your mouth acidic.
Okay.
I'm eliminating those, but most of the times when we eat, definitely it pulls the salivary pH down.
Okay.
When your salivary pH is down, by default, our saliva neutralizes it back. So just imagine whenever you think of food or when you see food, you start salivating. Right? Because your eyes are seeing this and then your brain is recognizing that you're going to eat this. So the first thing I have to do is to make sure that the mouth is ready to accept that food.
Correct.
So the role of saliva is so high, you're not salivating because you're liking to eat. Actually, that's a simile that people say, look at him, he's salivating so much to eat food, right? But the thing is, the brain has recognized now you're going to eat that food. Hence, it prepares your mouth to make sure that whatever you're eating is cleansed off your mouth. So one of the biggest reasons for our saliva to flow in our mouth properly is to keep your mouth clean.
Okay.
So the lesser amount of time food is stagnated in your mouth, the acidity of your mouth is at an all-time low. Right?
True.
So now imagine this situation, forget about the mouth. If I take, let's say, a bottle of acid, pour it here, immediately wipe it. No damage.
Correct.
If I pour it, leave it here overnight and tomorrow clean it, this will be some rough.
True.
Right? It'll be a rough surface. If I pour it every single day, leave it overnight, and then check it after, let's say, 15 days or 20 days, there will be a hole.
True.
This precisely happens on your teeth. So why is brushing so critical? Is because saliva can take off food from your mouth like cleansing.
Okay.
Right? It's like you have a car which is dirty. You pour water over it, but then unless you scrub certain things that are stuck onto your car as stains, it's not going to be clean.
Correct.
So basically you need a scrubber which dislodges whatever is stuck to your teeth, making sure that the acidic environment in your mouth is immediately neutralized.
Okay.
So this is the fundamental understanding. So as long as you can maintain neutral pH or alkaline pH in your mouth, the chances of you developing dental problems is 98% low.
Okay.
Today you may see that every nook and corner you have a dentist and a dental clinic, and the awareness levels are increasing because every fifth ad on a television is about a dental care product.
True.
Right? Which means that the disease patterns is increasing. You'll be surprised to note that 90% of children and 100% of adults have dental problems.
Oh.
Right?
Correct.
And this is going to be the next big pandemic that we are going to suffer, because oral health is directly connected to your general health. Research has enough evidence now to prove that poor oral health causes dementia, Alzheimer's disease, right? Stroke, heart attack, pneumonias, bone infections, women delivering preterm low birth weight babies, uncontrolled diabetes. All of this is caused because of poor oral health. We have only given importance to oral health from a very aesthetic perspective.
Looks nice, feels good.
That's about it, right? Of course, it does have that effect as well. So, if we are able to maintain this, so like you asked me, why is it important? And how do we actually take care of this? This is very simple. So now you just think from this perspective. If you eat something sticky, make sure it's out of your mouth.
Rinse your mouth.
Rinse your mouth thoroughly.
Okay.
Do it really well, right? Now the trick of the trade is, since you asked about Indian food versus Western food, if you look at it, that maybe our grandparents never went to a dentist ever. They probably also had lesser levels of dental issues. And there were not so many dentists existing.
True.
Right? Wherever there is demand, there is supply.
Supply, yeah.
Correct?
Yes.
So when there was no demand, there were no dentists. Right? Why is it that dentists are increasing in numbers? Because the amount of problems are increasing.
True.
So to find solutions, we are producing dentists. But like I said, dental problems are preventable. 98% of all dental issues are preventable. If you simply do this at your home, you will never get health in a clinic or a hospital. It's about how you live your daily life, how you are disciplined in maintaining certain basic hygiene that is required to be maintained. So let's look at diet, since you asked about it. Typically, if you see a traditional South Indian meal, right, the plantain leaf meal, and especially when they serve it in a temple or in a function,
yes,
the first thing that they allow you to eat or you're supposed to eat is a
pickle.
Sweet.
Sweet, oh yeah.
Right?
Yeah.
So the first thing you eat is a sweet. Then you go on to eat all the other things, the rice and the curries and sambar, rasam and all of that.
Correct.
Then just before they serve curd rice, they would ask you another round of sweet. After you finish eating your curd rice, if you ask them for another sweet, they will not serve it by tradition.
Okay. I was actually not aware of this.
Yeah.
Okay.
So they would say, no, by tradition, once you've eaten curd rice, you're not supposed to eat sweet.
End of the meal.
Yeah, it's end of the meal.
Yeah.
We will not serve you a sweet again then.
Okay.
So it's like a tradition and everybody just follows it. But if you deep dive, there is a huge science to this beautiful Indian culture that we have. Okay. Which is that if you've eaten sweet, it will lower your pH of the saliva because it is sticky, right? And it is sticking onto your mouth. So when you eat food that is fibrous, all the curries or palyas, what you call, and the rice and all of that, it by itself will cleanse it away. Okay. And then your curd rice will neutralize the pH of your mouth. Okay. Right? Once you're done with it, you should not eat a sweet. Right? Okay, that's... And so to inculcate certain good principles of our living or healthy living, these ideas were probably proposed and followed as tradition. True. Unfortunately, people have made it a fanatic approach without putting science to it. Even this is science, like what they're doing is science. But then nobody ever explained it to us and none of us tried to correlate it. We are working in two parallel lines. We are thinking modern science or modern medicine is different from traditional medicine or traditional living. True. It's actually not that. They are both the same. Of course, the 100 years, the 200 years of people living. Absolutely, right? So knowing what our body requires and how we can focus on prevention. So most or all of our Indian culture, what we talk about, is focused on primordial prevention, that you don't even get into a problem. Okay. Right? But somewhere down the line, we have lost that. And today we are focused about creating specialization, specialities, techniques to go ahead and try and solve a problem that you allow it to grow to a certain extent. You understand? So if you look at the burden of disease that is there today in the society, 90% of it is self-created,
Hmm.
right?
True.
And that is why there is a huge burden on hospital systems. There is huge burden on doctors. Doctors don't have time. We are producing many doctors to just keep on treating people. We are working at a very basic level, which is called downstream. So imagine if there's a stream, we are all working down the stream when people are falling into the stream, coming down the stream injured, and then we are, yeah, it's a never ending loop. And that is why you go to any hospital, it's full. You go to any practitioner, they're busy. This can be changed if we start working upstream. If we don't allow people to fall in the stream, then the burden here comes down.
True.
So is with oral health. And with oral health, connecting your entire body health, it is so important to understand what you eat, what time you eat,
Okay.
and then how you make sure that your mouth is clean will prevent you from 98% of problems.
That's actually very insightful. And doctor did mention about a very new thing which I think my generation is not aware of. I think because of the Western influence, we eat dessert at the end.
Very well said.
Yeah, which is like the deadly opposite thing to do, like you mentioned.
Exactly.
Considering the pH.
Exactly. pH and stickiness. So you just imagine, Chinmay, in the West, let's say America or Europe, they have access to knowledge, they have access to care, they have money, right? But still, 95% of their population suffers with deadly dental issues.
True.
And the single most important reason is their diet. As simple as this. The more refined food you're eating, the more it is sticking onto your teeth, and the longer it is staying in your mouth, you will have dental problems. No dentist on this planet Earth can solve you of your dental problems by going to them.
Correct.
Right? And unfortunately, true, dentistry is painful, dentistry is expensive, and dentistry consumes a lot of time. People lose so many million work hours every year going to dentists. Children lose so many school hours going to dentists. And it's not about just losing time, but it's also the experience that you go through, right?
Yeah. It's painful, it's scary.
Yeah, it's scary. Nobody likes, even a dentist doesn't like procedures on his own teeth.
True.
Right? None of us like. And the unfortunate reality is also that we as doctors do carry the burden of the uh, entire emotion to go ahead and do certain procedures on certain people. We don't like to cause harm, right?
True.
And as dentists, we don't have the luxury of general anesthesia. We operate purely on local anesthesia.
The mouth should be open at all times. Yeah.
And it's a very, very, very delicate procedure to be done and humongously stressful. Among the entire medical profession, dentistry is among the top most stressful professions because there is a physical element to it wherein we don't have access to the mouth, we don't have visibility, and then we still have to work in millimeters. For me, 0.25 millimeters is a huge distance to transverse. If I go wrong in 0.25 millimeters, that can make a difference from a filling to a root canal. It can make a painless procedure highly painful. It's very, very complex.
Correct.
It's not so easy. Plus, not to forget, there is your tongue, there is your cheek, there is your lip coming all around, and if you just shake, you're done. Our drills rotate at lakhs of rotations a minute.
Oh, yeah.
So for us to perfect that skill, to be able to remain calm and composed and still give the patient that confidence that we will be able to do it, takes a lot of stress. And then outcomes. Today, everybody wants outcomes because the internet is saying, this is the perfect way to do it. And you do this and this will happen. And then it's very easy to see edited videos of people smiling, laughing, saying before, after it changed. But the truth of the matter is not that. I'll tell you, in 28 years of my life, I have been meditative whenever I have consulted with patients, whenever I have done procedures. It is taxing. I literally get the feeling of me being an Ayrton Senna or one of those Formula One drivers. It is as stressful as that. A lot of times I feel that I should go ahead and check my weight before and after some of these procedures. Maybe I would have lost weight. So the point is, all of this burden can be taken off if all of us actually follow certain fundamental processes. So
Okay.
that's the biggest difference. We are already gifted with the knowledge and the science behind eating in India, and we are following the West. Like you rightly mentioned, going ahead and eating dessert is the biggest crime you can do to not just your teeth, but to your general health.
Very true.
Because if you don't have good oral health, your general health is going to be hugely compromised.
That is very true. You did say an interesting fact about fundamentals of oral hygiene. If you could quickly give a small brief about what that is to our audience as to what.
Well, it's pretty simple. Brush your teeth twice a day.
Okay.
When I say twice a day, technically a lot of people are brushing actually once a day, though they claim they're brushing twice a day. I'll tell you in a very simple way how.
Okay.
Why do you brush? To take off food that is stuck onto your teeth,
Correct.
right? If you have brushed at night before going to bed, you'll get up in the morning and brush your teeth, which
Correct.
is futile. What are you brushing? You're brushing clean teeth,
Yeah.
right?
Yeah.
So the people who are brushing this way are actually brushing once a day. You're just wasting toothpaste, right? You should brush after breakfast and after dinner. Number one.
Okay.
Number two is, do not brush immediately after you've eaten your food. Don't do that. Because like I mentioned earlier, that when you have eaten your food, your acid levels or the pH of your saliva reduces and it becomes acidic. In about 20 to 40 minutes, the saliva by itself will neutralize your mouth to bringing it back to normal pH. So when your mouth is acidic, if you go ahead and brush before that 20-minute of your eating, then you're actually doing a great injustice to your mouth. It's like having an acid in your mouth and you brushing and scrubbing. So it's actually going to wear off your teeth faster. So the right way to brush is wait for 20 to 30 minutes after you've eaten your food and then go ahead and brush.
Okay.
Right? Ensure that you rinse your mouth after every meal or every time you've eaten or had some drink.
Okay.
Make sure that your mouth is continuously, swished with water. So rinsing is most important. I mentioned about brushing. Next would be eating food, right? So make sure that if you're eating something sticky, eat it just before you have your meal or eat it during your meal. So don't eat it after your meal. And the worst you can do is eating a snack which is sticky between your meal, which is like between breakfast and lunch, between lunch and what we just want to munch onto chips and other things when we are watching television is very, very harmful.
Okay.
And don't be under the misconception that if you eat little, then it is not as bad as eating a lot. Whether you eat half a chocolate or you eat 10 chocolates, your pH will vary. It will have the same effect.
Okay.
So always ensure that if you're eating sticky food, then you should eat it just before you start your meal or during your meal.
This is something very new I have learned today.
Yeah, this is the simplest way you can. So you can still go ahead and eat 10 chocolates a day and not have a single dental problem. It's another story that will destroy your general health. But in effect, what I'm trying to say, so you can still be a whole, rice and roti, chapati eater and have a whole mouth of tooth decay. And I can eat 10 chocolates and not have a tooth decay. It's a misconception that people have that sweets and chocolates cause tooth decay. Actually, if you understand the science, it's not sweets and chocolates, but it is the stickiness of any food that gets onto your teeth. So ensure that you eat this way, you do all of this. Second is make sure nothing gets stuck in your mouth. So the quality of even your dental work matters.
Okay.
So a lot of people go through fillings, let's say caps, root canals, large fillings and dentures and stuff like that. Implants, whichever way. So if your denture or if any of those prostheses that you're wearing itself is harboring food
Hmm.
to be stuck onto them.
Okay.
So then the pH of your mouth will remain acidic, will
True.
cause more and more dental problems. That is why precise dental work is extremely important. A lot of times we see there is cap and there's a huge gap between the cap and the tooth, or the the fitment of your denture is not perfect, and the other teeth where it's holding on with the clasp and other things are holding so much amount of food and stuff like that.
Okay.
Right? So imagine what's happening on people who are going through braces.
Oh, there's a lot of food getting stuck.
Right?
Yeah.
So I have seen thousands of people who have gone through braces fundamentally to correct their teeth straight, but at the end of braces all their teeth are decayed, and they go through multiple root canals and crowns and stuff like that after that. So basically, one of the pre-qualifications of you being eligible for doing braces is your motivation to maintain your teeth well.
True. That's very true.
Right?
Yeah.
If you're not brushing your teeth well, don't go ahead and get braces done. Because it's like, if I'm not cleaning my hand after my meal without anything, and then you give me 5 rings that I wear and eat my food, how am I going to clean that
Exactly.
between my fingers and the ring, right? That's what is going to be on your braces.
Correct.
So it's so very important that you make sure that the fundamentals at your home are okay. Without which, what's happening today is that, oh my God, I've been visiting a dentist for like 10 years now. Every time I go, there's a root canal. Every time there's a crown. But actually, he or she can't solve your problem. Doctors actually can't solve your problem. It's like you buying a Mercedes-Benz car and then going ahead and giving it for service once a year. But at your home, you're never washing it and cleaning it. You're not driving it the way it has to be driven. And then you're going and telling them that what kind of a car have you manufactured?
True.
Right? So your health is your responsibility.
Correct. I totally agree with that.
Isn't it?
Yes.
And I personally feel we should change this whole paradigm in our understanding about healthcare itself. If you imagine a triangle, today what's happening is, here is you with a problem, and here is the problem. You and the problem. Go meet a doctor and transfer this to him and say, you solve it for me. He cannot solve it. That's a
There has to
failed
be a detective to find out what
yeah,
you're doing.
exactly, right? Whereas you change that triangle and you put the problem on top, you be here and the doctor is here. You become partners in solving that problem. The doctor can bring his skill set, his knowledge, his ability, all of that into the fray to help you.
Correct.
But you have to be honest about what you're doing. Right? So many times we find patients not wanting to take medications that we prescribe, and they keep complaining that the pain isn't gone. Now, I can't solve that for you.
Correct.
You have to be honest. You have to declare saying, I didn't take it.
Yes.
It is very painful. It is very painful to see some of these behaviors among people, and then not following the right instructions of eating, drinking, chewing, all of that. Don't hide it from your healthcare provider. Actually, your habits must be discussed with your healthcare provider, because then we both can become partners in trying to get you over that. It is perfectly fine to say, you know what, doctor, I feel so tempted when I see chips. I feel like eating it.
True.
Doesn't matter, but be honest about it. The solution comes then. Then your healthcare provider will find solutions on how he or she will make sure that either by perseverance or by education or by being available to you or by tapering it off, in whichever way. But your healthcare provider should, must, and will try to be with you as your partner in making sure your health is better. That is healthcare for me.
Very true.
Isn't it?
Yes.
It's not a transactional business. It's not a transactional business. You have partners in your business, you have partners in your workplaces, you have partners as your husband, wife, boyfriend, girlfriend, whichever way. Similarly, you should have a partner in your healthcare. It's not a transaction.
Yeah, that is very well said. I see. I believe you speak all this because you've had experience of patients lying to you often. Am I right?
No, not often. Actually, I don't have this because a lot of my patients actually are honest.
Okay.
And I have discovered that this is the only way that we would. There are random one or two samples, but
Hmm.
most of the people actually see, we have made this world a very bad place. Like if you look at social media, nobody has trust,
Yeah.
but it is not so. People are lovely. It's just that we have created so much amount of distrust that nobody is wanting to trust another person.
Very true.
Isn't 20 years ago, we would just get into any random auto, ask for a lift, get in and going. But look at the system, how it's eroded, right? You're sitting on a bike of a person, but with GPS, still you don't trust him. You're sitting in a car with all the tracking systems in place and you're anxious about where you're going, what's happening. This has led to such degradation of faith between two individuals that it is not between a patient and a doctor. I think we have degraded trust and relationship issues among every interaction that we have.
That is very true.
No?
I
And it
couldn't
is
agree.
time that we actually revive it. Unless you trust, you will never heal. It will never heal because healing doesn't happen here, healing happens here.
Correct.
So you have to send the right signals from your head, right, to yourself. And that's when your body heals. It doesn't heal just because of uh, you going through a procedure.
True. And I think that is why we need more doctors like you who can bring that confidence and that comfort in patients so that they can tell what their issues are without, feeling shy or, if I tell doctor I didn't take my medicine yesterday, he'll get angry. So, no, I'm taking my medicine on time.
Yeah.
So to avoid all these, so I think what you said, that becomes a very important role.
Yeah.
And
And most people are very nice. Most people are very honest. But it's also the onus of the doctor. It cannot be one way. We are also producing doctors who probably are preconceived that the patients are now different. Patients are not trusting me. Patient is going to be nasty with me and stuff like that. And the media requires information which is going to get them more views, I guess. And so we also showcase that sort of. But people in general are very nice.
yes.
So it is also important for a doctor, and that is where I'm very focused about speaking to younger generation of doctors on how should they build their practices and their legacies as doctors. It's not about doing a procedure. The more you keep doing, it means that you're actually not solving the problem. The goal of medicine is to see its own end. The goal of medicine is to see its own end. It's not to create more disease and keep treating it.
Correct.
Actually, a doctor should be paid the highest amount of money when the population is healthy.
Yes.
Just imagine, every morning we are coming and worshipping God in our clinic, asking for what? More patients should come to me. Isn't that counterproductive to the profession itself?
Very true.
No?
Yes.
And imagine all the patients are coming and telling us, you're like God. I'm not like God. If I'm thinking that my patient should be unhealthy.
True. It's become more like business oriented, you'd
Yeah,
say.
that's the unfortunate reality. Because our metrics of success is in the numbers that we make,
Yeah.
right? And somewhere all this MBA people running healthcare systems and policies and stuff like that has become this, and doctors don't have a voice, doctors don't have a say. And that's the unfortunate reality of how this everything has become a product. Science has gone to toss. Like somebody will see that, oh, can this procedure be done at home? Is this the highest thing in demand? We will manufacture it and we will give it to your home and you use it there, and then I make money and valuations of it. What happens to science behind it?
True.
Right? And patients are going by advertisements and using them.
I think at higher levels, they should place more doctors so they can have some say in the management issues like this. Because, like you said, people without the knowledge of actual science behind the procedures are sitting on the top and making the decisions.
Absolutely. It's a very famous thing to say that doctors don't understand business. That's the theme that most people. Why are doctors not at the helm of let's say large healthcare ventures? This is the reason. But then no doctor has ever questioned and asked that what of medicine have you studied in your management? What of healthcare have you studied in your management? But both ways, what is missing is human care.
True.
So to me, actually what needs to change is right from the term that we are calling it. What I want to become a doctor. Why do you want to become a doctor? Because I want to do a cardiac surgery. I want to become a neurosurgeon because it's thrilling to go do a neurosurgery, right? You rather create all these VFX, VR, AR and all of that and give it to kids to play around.
Yes.
That should not be the reason for you to become that. Your reason to become that should be true passion to heal and help people who have gone through distress or trauma.
Very true.
So the flip is that. So then you are thinking that I will do great procedures for which I will become a doctor, and then we will bring in great people who do these procedures, are the minds of the management which is thinking, who create healthcare facilities. In the center of all of this is a patient who is a human being.
Correct.
And he is being tossed around because somebody is some specialist and somebody is some diagnosis and somebody is something else, and then you're being tossed around the entire jargon of this, where he is unable to heal himself. He cannot heal because he has not met a single person who is a true human being. Like it's said in our Vedic literature, birth, old age, disease and death is inevitable. Right? So are we trying to make people immortal? Some patients and doctors also expect the same thing. And they say, don't worry, I've done this, you'll be fine. There's nothing like that. But if I am going to be a doctor who's a true human being, who's able to sit with my patient and talk to them, understand their whole life and whatever emotions they have gone through, and handhold them, that is human skill. This skill is never taught to us being doctors.
True.
Right? Yes. So for you to develop human skills, you have to be a good human being at the first place. So whether so whether you're studying management or you're studying medicine, the only way this ecosystem can change is when we actually base our entire agenda on humanity, on humanness. That's what is lacking.
True. In this busy world, I think this is the basic concept that has slipped away.
Isn't it?
Yeah.
So imagine, we should change the names itself. Right? Instead of calling myself a doctor or something like that, I'm a human care expert. I'm a human care expert who takes care of oral health of individuals or people.
That's great, actually. It's nice to hear also.
Right? I'm a human care expert of the heart. It's not scary to you to listen also.
Yes.
And then when a student who is in his 10th or 12th standard wants to become a doctor, he is thinking that I'm going to a human care college.
Correct.
Right? So when that term changes, the kind of people will change their mindset, and those sort of people will join the profession. Those sort of people will get educated in this particular term or terminology, and those sort of people will come out who will actually change this whole ecosystem.
Yes.
Now, if you just go and ask people, what do you do? I'm cardiologist. Oh, you're putting that stent in there and you're doing this, this, this. Oh, you're neurosurgeon opening brains of people. Oh, you're pulmonologist doing this, this, this. You're orthopedic surgeon. Talk about it. Go ask anybody ortho. Oh, you're doing knee replacement. Why? That should be the last thing that you're looking at.
True.
Isn't it? Anybody talks to your dentist, oh, hal tegdiyappa ivattu. Like, it's not about removing somebody's teeth, right? But it's about making sure that the person doesn't actually fall ill. That is a doctor.
True.
We just put boards saying prevention, 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 preventive diagnosis, like, preventive checkup. What does it mean? It means nothing. You are doing preventive checkup to catch somebody who's requiring intervention, or you want to do intervention. But if I'm truly preventative, I'll sit with you and talk to you about why problems happen, how at your home you can solve it, what are the advices that I'll give you. Keep myself open to have the time and efficiency to have a conversation for you for the amount of time that you require. I can't define it. Sadly, the research says that today doctors in India spend an average of 2 minutes on their consultation with their patients.
True.
Right?
True.
If that's the case, where is our health going to improve? Because you're not able to relieve the anxiety of the person.
Yes, this is something I've experienced firsthand. I just went to my a new dermat yesterday because my dermat was out of town. And I actually went, I didn't have any major problem. I just went to ask some questions like, I've been using so and so creams from so long. Is it good? Because they're steroid creams, and should I change or should I stop? So I just went and I had some dryness on the skin. She said, no, nothing. You can just apply moisturizer. And she's like, you can leave. And I said, okay, I waited for this and I paid for this just to hear this. I said, no, no, doctor, can I ask you something? And I tried to get out some information. She's wondering, this child doesn't need this information. Why is she asking when she doesn't have a problem?
Yeah.
So I feel there's somewhere that connection is lacking.
That's only because of the lack of human skills.
True.
Because we feel great when we do something.
True.
Right? So I constantly ask the team of doctors with whom I work, suppose you see somebody's mouth which is absolutely clean, doesn't have cavities, doesn't have gum issues. What are you going to tell them?
Appreciate them.
Right?
Yeah.
So, in fact, I would go one level above and find out what is it that they're doing which is so great working for them, because that's ultimately proof in the pudding, right? I might have all the theory and the knowledge, but here is another opportunity for me to learn from a 22-year-old on how he or she has maintained her teeth so clean that there are no problems. Can I learn for it for myself? Will I be able to take this knowledge and share it with somebody else that, look, I saw somebody like this, and then go on to talk to them about prevention and tell them that, look, what you're doing is absolutely great. If you continue to do what you're going to do like this, how it is positively going to impact their health, lifestyle, confidence,
Correct.
all of that.
Very true.
Right?
Yeah.
But we think that, oh, he doesn't have anything, I don't have anything to do in him, so I don't need to spend time with him. No, spend the same kind of time with that person.
Exactly.
Continue to encourage him to maintain whatever it is. Because if you have not given a direction to a person, the person doesn't know that he or she is doing something right.
True. And coming from a doctor, they'll feel more validated.
Exactly, right? So imagine if I'm doing something, and there's a beautiful story, I'd like to mention this in our scriptures, that there is a tribal guy in a forest, and there is a sage who comes on a boat. There's a storm and his boat is broken. He's injured, fainted, and stuff like that, lying on the shore. So this tribal man takes him to his home, gives him nursing care and stuff like that, and slowly he recovers. Once he's awake, he starts to recover. And this man is full of gratitude and love for God, who the tribe guy. So the tribal guy does puja. And when he's doing, the sage watches and says, you know what, everything that you're doing is wrong. Right? This is not the right procedure to do to God. So he says, I'm so blessed to have you. Please teach me. He learns it, the right technique to do his worship. At the end of it, the sage has recovered, so new boat is made for him, and he sees him off. And he would have taught him all the right way to do all the procedure. And when he sees the sage off at the shore, and the sage goes, this man returns back to his hut and then wants to do his puja and realizes that he has forgotten one step.
Okay.
So he starts running back in the direction towards the water, and goes, meets the sage and asks him the question. The sage is going in that boat, you know what, please tell me, I've forgotten what's the right way. The sage is astonished. He said, for so many hundreds of years, I have done everything right, but I didn't get the power to walk on water like you did. So please go back and do whatever you're doing, which was right.
Wow.
Right? So in all our lives, that intent is very important. That intent is very important, right? So the intent with which I practice is the most important element for a doctor. The intent with which you're going to seek help as a patient is so important for you.
Correct.
Right? So to bring it to context, if there is a person who is completely ignorant of he maintaining his oral hygiene very well with whatever he is doing, if he is not certified by a doctor saying that whatever you're doing is doing great, continue doing it. Continue doing it. You're doing it well. That gives that person the confidence that whatever he's doing is right. Otherwise, he'll also see some social media reel and then he will think what I'm doing is wrong and go ahead and get misdirected.
True.
Right?
That is very true.
And this is so important for all of us.
Yes, and I think we can't even blame the young doctors because they are not trained on the same thing. Probably the doctor I mentioned, she was a pretty young doctor and might be wondering as to my skin is normal. She said, see, if you look from an outside point of view, it looks neat, there's no harm, there's no infection. So she must be wondering that I'm wasting my time here. That might be her perspective, telling, just go home, don't worry.
No, more than that, I think it's when as doctors we see that there is no problem. It means that I'm not wanting to do any treatment on you.
Yes, so we have no business further.
Yeah,
like
so that becomes transactional.
True.
And that's where the human element comes, right? So human care. So I am a human care expert for your skin. If I term myself that way, then I'm going to use my human skills to connect with you, to understand with what you're going through, and also maybe give you certain tips on what you're doing right and how it can be enhanced, right? And make that connect. And that's precisely what's lacking. And that is why people are all suffering.
Very true. And like you said, with the hospitals giving them targets and everything, it becomes more burden for the doctors as well to, keep treatments and also make sure that these many people are treated.
Yeah, it's very stressful. How can you predict disease patterns, right? And how can you predict how many people are going to fall sick with this particular disease for this particular month?
True. And like you rightly pointed out, the end goal should be to reduce the number of treatments and to reduce the number of medicines that we are giving. But like you say, hospitals take pride in telling we've treated these many lakhs of people. And
exactly. And we truly don't have a 360-degree care model, right? How many of us connect one particular organ to the rest of the body? We don't do that, right? If there's a heart issue, it has a connection with your mouth. If there's a mouth issue, it has a connection with your mouth. If you have a mouth issue, it has a connection with your lung. If you have a mouth issue, it has a connection with your eye. It has connection with every single organ.
Correct.
Specialization is not to get away from people. It is actually to bring people together, organs together.
True.
Right? And that is the fundamental ethos with which we should work. We all take pride, we get egoistic about our degrees in specialization. We all take pride in our egos of specialization and so on and so forth. But truly speaking, we should grow more and more humbler. And every day you grow, you have to understand that you're treating somebody who is in discomfort. And how do I solve that discomfort? And how do I actually think? How many doctors go back home and think about their patients and think, how could I have done what I did today better than what I could do, for my patients? How many of us pick up our phone calls thinking about that particular patient and call them back for a review thinking, are you still in pain? Is there somewhere that I can be reached out to? That's our profession. That's what it should be. Most doctors are this way. But unfortunately, like I said, there is erosion of faith.
True.
And that's like gas. It's like air. You can't see it, you can't know it, but you can feel it. We should restore that.
True. That's one thing that in this busy life we have like completely lost, I can say. People have totally forgotten the true meaning of what it is to treat others, or just even to just simply greet someone or just say hi. Everyone's on their phones, like
Absolutely.
even while driving, even in the metros, every time people, they're not bothered what is happening around them, next to
Yeah.
them. There could be a earthquake happening a mile away, and still they'll be
Yeah.
like, okay, scrolling on their phones. That is very rightly pointed by you, sir. And as someone who has gone under the braces treatment myself, like you said, to maintain that hygiene used to be a very big issue.
Yeah.
I used to stop eating because, oh, now if I eat, I have to take a toothpick and pick out each one of them. And I'm like, it's fine today, I'll just not eat, I'll eat later.
Oh God.
So, this was the kind of issues that we face with the braces treatment. Also, if I could ask you, which category of people would actually require the treatment, and is it actually necessary for all, or what is your expert advice on the same thing?
Braces.
Yes.
So there are only two reasons why we predominantly do braces.
Okay.
One is for aesthetics or looks, if the teeth are crooked. Two is for functional reasons, if your bite isn't okay and stuff like that. To me, you should never treat aesthetics,
Correct.
right? Because beauty lies in the eyes of the beholder. As simple as that.
Very true.
Whenever we do intervention on our body, in any procedure, however safe and however non-invasive, there is an element of fundamental shift in the physiology,
Correct.
right? If I have to move a tooth from position A to position B, what does it require? It requires some force to be used for me to move this from here to here. What is holding the tooth here? There is bone and there is gum around it. So there will be a shift in that particular pattern. There has to be loosening of the bone. It's like moving tree from position A to position B. You have to loosen the soil and then move it to another place and then pour new soil here where there was a ditch which has happened because of the movement of this one here, and then where you have moved the tree to, it requires additional soil, so you'll put anchorage to hold it so that no goat or a bull comes and hits it, and then put more soil, stamp over it and make it strong. The same thing happens in your mouth. But when you see, this is very easy in soil to do it, but still you transplant a tree or move a tree and see, it's not so easy. There is risk that that tree may dry,
Yeah.
right? It may not get the same, so the same complications can happen in your mouth. So the more you're doing it for aesthetic reasons, you're at larger risk for more damage.
They're cracking the foundation.
Exactly, right? But it is far better that you find different other ways by which you can manage. So today it's become a fashion statement that everybody wants braces. Everybody wants to wear any form of braces, right? Ceramic braces, metal braces, those invisible braces, all of them. But fundamentally, you're moving your teeth.
Correct.
Right? So unless it is really bad in terms of aesthetics, there are conditions in which we would require people to have some confidence also.
Correct.
Right? In those cases only do it. Or if there is very severe bite issues, very severe issues that can cause damage to your surrounding structures, like to your temporomandibular joint, your jaw joint can go dysfunctional if you don't have the right bite.
Correct.
You can start getting headaches, neck ache, backache, shoulder pain, all of that because of a wrong bite damaging your jaw joint. And you'll keep visiting ENT surgeons, orthopedic surgeons, neurologists, physiotherapists, and so on and so forth, who probably will not even recognize that this is the problem, and you will end up getting treated for all of those unknown problems arising out of your mouth. So there are certain conditions which you have to choose, but predominantly I would refrain myself from doing it for aesthetics. And like I said earlier, the qualifying pattern for you to wear braces is how well you are determined to maintain your mouth clean.
It becomes more challenging, as you say.
Absolutely. So the more you are unhygienic in your mouth, the lesser are you qualifying to wear braces.
Okay. So if you're someone who's determined to maintain hygiene, and you
Yes.
should at least change once you're getting the braces done, make sure.
Absolutely. And also be understanding the risks of doing braces.
Correct.
Right? It's so when we propose any treatment to patients, they would say that, no, 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 I don't want to get this done.
Hmm.
But so easily, are we not taking off 4 teeth which are healthy and getting braces done,
Yes.
right? So think about it. You're losing an organ. It's like me telling you that I'm going to take off your gallbladder,
Hmm.
right?
Yes.
You have never seen a gallbladder. You don't know what it does and stuff like that. But still, it's a loss. So yes, so balancing is very important. Taking the right opinion is very important. So don't blindly follow social media. Don't blindly follow any random advice because my neighbor's kid got braces. I also
Huh.
want braces and stuff like that. There are very good qualified doctors who will advise you whether you require really, don't require, and
Hmm.
then make that decision.
So meeting the right kind of
Yeah,
doctor also becomes important in
it
this
is.
case.
It is.
Hmm.
It is. You should find healthcare providers who are ready to spend time with you. You should find healthcare providers who are not offended by your questions. You should find healthcare providers who are willing to walk the talk. Like I said, being a partner in your healthcare system. They should be your partner. And that's the only way it will work. And that's the right word to use. That he is my partner dentist. He is my partner healthcare provider. And that is the only where you should also have the liberty to share
Hmm.
your habits, your work, your difficulties in brushing. It's perfectly fine
Hmm.
for you to say, you know what, I somehow am every day tired at night, I don't feel like brushing. But the doctor should, your healthcare provider, your dentist should actually be able to sit with you, have a conversation, and bring you up to pace. It is better that you take 3 months from now to actually develop the habit rather than you not sharing it ever, or he not knowing it ever, or he or she not spending enough time with you in coaching you. It's like
Correct.
parenting.
Yes.
Healthcare precisely is like parenting. You can't expect a child to be doing diligent homework every single day. There are days where the child is distracted.
Hmm.
The parent always doesn't reprimand the child. The parent will actually sit with them and talk to them about consequences,
Correct.
right? And
That
over,
becomes important.
isn't it?
Yes.
So it's like coaching. So I am your health coach. I am your healthcare partner. To me, that's the view of being a healthcare expert.
It would be very beautiful if everyone got
Yeah,
the same perspective.
isn't it? And it's very simple.
Yes.
No?
But that is something that it has come from your personal understanding, I can say.
Yeah, it's one from personal understanding. Second is about understanding truly what do our patients want,
Hmm.
right?
Correct.
Third, and the most important thing is at the end of the day, I always go ahead and reflect on my actions, on my words, and everything. And then you understand this simple aspect that, I am coming back home dissatisfied, that I wasn't able to help somebody.
Hmm.
The person who came to seek help from me as a patient is also dissatisfied. What's the purpose of life? So it's very important to reflect,
Self-reflection, yes.
isn't it? It's
Yes.
very, very important. So then you come up with these thoughts that, yeah, so what is stopping me from asking 10 questions to that particular person and giving out all the information that I have? The fundamental disconnect among most knowledgeable people in any field who are actually, let's say, doctor. Why is it that I have been taught this particular knowledge? It's one is for my own skill development, but the
Correct.
second is this knowledge should be shared by people who are in need of it,
Hmm.
and we forget that.
Should be useful.
We forget that,
Yeah.
right?
True.
So empowering people with the right knowledge is such an important aspect
Hmm.
of care delivery.
True. Like they say, the more you teach or the more you share, you get to learn a lot more.
Yeah,
It's important to spread that right kind of message also.
absolutely.
So I also wanted to ask you, these days the invisible braces or the invisible aligners, what we say, they're very much in trend. So like I don't see many people taking a doctor's opinion before that. It's become more like an accessory, like how we go purchase something and wear it. It's become more like that. So do you think it is safe to use one without a prescription?
Not at all.
Okay.
Very well said, actually, that it's actually become an accessory. I was all this while looking for the right term. but I never had it. Thank you for giving me that. So it's definitely not an accessory. There's a huge science to tooth movement. Like I mentioned, that as a dentist, we are trained to understand what age, what time, and by what means should we actually make this choice of moving a tooth from one particular position to another particular position. Unfortunately, people who have looked at it like a business opportunity have productized this and made it an accessory, like you said, and saying we'll deliver this at home. But this is the biggest blunder that has happened in the entire science of oral care.
Okay.
People are not realizing it today, but over a period of time, I'm certain that people who are going through all of these things will realize that their teeth movement has actually affected their oral hygiene. A lot of movement that has happened may not have happened the right way, wherein they'll start getting pain and aches all around their jaw, head, neck, back, and shoulder. They will not even relate it to this. Their gum health can get deteriorated to an extent that their teeth can get shaky. And most importantly, all the teeth they have which have been moved from one position to another position can actually relapse, causing creating gaps between teeth, which will lead to tooth decay, which will lead to gum disease, which will lead to deterioration of your health, generally. And so it's one of the most non-scientific things that has happened. It is not at all to be considered as any option that is coming in oral care for you. Please meet a qualified dentist. They will guide you to what is the best thing that has to happen. Don't just blatantly go ahead and buy any of these things that are just off the counter available to you or being delivered at your home and stuff like that. Very dangerous.
True. I think it's not good to mess with medical
Not
tools
at
this
all.
way. So if anyone is using aligners just by yourselves, just because you think, okay, I have a small correction, it might
No,
get
no, no.
fixed. So like our doctor said, please don't take that kind of
Yeah,
step.
absolutely. Please take professional help, visit a clinic, meet the qualified person and do it.
Very true. And like you said, when these kind of things turn into a business model,
Yeah,
it becomes very difficult to treat the end goal, which is to be having a good oral hygiene and to maintain
absolutely.
the cleanliness in the mouth. That somewhere gets lost in the beauty of seeing aesthetic treatment.
Absolutely.
And these days, even we see many people spending millions of dollars on those perfect smiles. And yes, it is for some people in their profession, they might
Yeah.
need it, and it might be a crucial aspect. But now I feel it has become a key accessory even to commoners. So, your personal take on it, I know it many people see it from different angles of view, like, looking good is also equally
Yeah, yeah.
important, but for what profession? So,
So, like I said, it's a very good question. Statistically, if you see, people with less confidence as adults would have had bullying in their school when their teeth weren't okay. So, a lot of kids with decay in their teeth or teeth that have been removed earlier than they would actually fall land up with gaps between their teeth, and their peers in their school would have bullied them. And their confidence levels would have gone down. It's so common for people to call, hey, look at this fellow, is like Gateway of India. And, his speech is lisping and so many things. And so they lose confidence and they grow on to be adults. I've seen so many adults with some crooked teeth and stuff like that who never smile. And you'll think that they're very serious individuals, right? But truly they are not. It's just that they are so conscious of their smile that they don't smile and they come across like serious individuals. So if you are in a profession like yours, like if you're a model and where looks matter, then you make the choice of aesthetic corrections. Two, if it is affecting your confidence, right? Let's say every time you're smiling or you're talking to somebody, instead of the matter that you have gone there for in terms of your business, you're constantly thinking about your smile, then please go ahead and get it corrected, because ultimately you have to have a balance. between the two. You can't live your life caged in the thought that your smile isn't good and the people who are in front of you will keep judging you for that. So you never smile, you never talk confidently and stuff like that. I've had several patients who were in sales and who were not actually successful. The moment we corrected their smile, their positions in their companies, they got promotions because they did well in their profession, and it was simple that they could smile well, they looked better, their confidence was better. That's the impact that it can have. And so yeah, so these are some of the key factors that one must make sure that you make that decision.
True, like doctor rightly pointed out, unless and until it's affecting your confidence or your career in a very major way, I don't think it would be necessary to add on to these kind of
Yeah,
corrections.
absolutely.
That is the, yeah,
Absolutely, yeah.
that would be the gist. I think, and this kind of information should be spread more to the people and the audience, because people think having a perfect face, having a perfect body is the ultimate goal.
Hmm.
And they forget in that process that it should be healthy as well.
Yes, not just they forget. I think they don't even think.
Yeah, they don't even consider that fact.
Yeah, we have reached a stage of ignorance that we don't know that we don't know.
Hmm.
Gottilla antlu gottilla. That is the level of ignorance that we are in, wherein the thought itself doesn't cross. Because I see a lot of people say that all our lives are being led by social media influencers and influences that come on social media. What you wear, how you talk, how you behave, what you eat, where you go, all of that is apparently being influenced by social media.
True.
And it would be nice to see if there is also enough amount of influence on the right aspects to lead our healthy life. So I wish everybody the best. And hopefully, we will see an era where there is enough confidence and trust between healthcare providers, or I would actually love to call them human care professionals, and people around us.
That was so nicely told by Dr. Srivatsa. Like he mentioned, there should people are losing individuality out of following the trends, perfection, the perfect teeth, a perfect smile. And another beautiful thing that Sir mentioned, healthcare professionals.
Yeah.
So that term, if
Human care.
human care, yeah, like rightly pointed out, human care professionals, if this brings a revolution in
Yeah.
the industry, that would be, I think, for the better of humankind and a good deed for all of us as well. And I really love that thought, sir, that you
Thank
got
you.
in
It was
today.
lovely to have this conversation with you,
Thank you
Chinmay.
so much, and I hope the audience got to learn something from this podcast. And
Absolutely. And let's continue more topics.
yes,
I'd be happy to share my thoughts and views, and hopefully, it'll benefit everybody who's watching or listening to us.
yes, sir. Thank you so
Yeah.
much once again.
Thank you, Chinmay. Thanks for making the time.